Jabr is a leading psychiatrist, psychotherapist and a trainer in practicing in the public and the private sectors within Palestine, in her native city of Jerusalem, and in the West Bank. Dr. Jabr, how has the mental health of Palestinians been affected by the occupation?
Well, thank you for having me on this show. And in fact, Palestinians have been suffering from chronic oppression and fluctuating intensity of violence from time to time that touches almost every aspect of their life. It touches economy, development, education, health, including mental health. Psychosocial suffering like stress, grief, and traumatic reactions, increased anxiety, depression, are some of the responses to life under occupation. This in addition to a very common but less reported injury that is commonplace among many Palestinians. That's the injury of humiliation resulting from the daily friction and the daily interaction with the occupier.
And Dr. Jabr, how does the lack of Palestinian statehood affect people's mental health?
You know, Palestinians feel like unprotected. The lack of statehood and the dysfunction of the protection of the leadership in the face of the continuous Israeli aggression and international apathy towards Palestinians and all the harm that happens to Palestinians makes most Palestinians feel like orphans, unguided and unprotected. When Israelis harm Palestinians and enjoy total impunity, people want to take their right by their own hand. And this explains why you find the current phenomena in Palestine, where you find untrained, unarmed children going after a well-trained and unarmed Israeli soldier trying to stab him. It is because of the damage that happened to the role of the father over the years. And when the leadership cannot protect the people, when they behave like dysfunctional, unable to protect, it is the children who want to fill the vacuum and act as the leaders of this nation.
And you've been critical of foreign clinicians coming to occupied territories. Why is this?
Well, I'm critical of some foreign clinicians who come to Palestine with excitement about coloring their CV with war experiences and feel overconfident about bringing us methods and interventions that were developed in a more peaceful and in a more resourceful part of the world, in the West mainly, expecting that they will work for Palestinians in the context of occupied Palestine. On the other hand, I welcome foreign clinicians when they come here, when they come to Palestine, with solidarity and empathy, validating the Palestinian need to struggle to end the occupation, when they are sensitive to the political and the cultural context of the Palestinians, and when they are willing to learn from the Palestinian experience, to learn from this unique context. I do believe that our interventions and therapeutic techniques should develop in this unique context and not be imported from a different reality.
Dr. Jabr, I'm going to bring in Gona there because you're nodding away, and I think you appreciate that. I mean, I was sort of referring to taking Western-style therapy out to, say, Palestine or the Middle East. What are the problems there?
I have to say that I agree with what our colleague here said in
Jabr.
regard to in regard to the models that are used, like in counseling and psychotherapy, and I certainly could see that in the even here in this country, in Britain, when the women come to our organization for help and they need some sort of psychotherapy or counseling, we refer them. They don't stay on it. And that's because of some of the issues and barriers. They don't feel that it works for them. Personally, I think people's experiences has a lot to do with the way they react to treatment, especially to psychotherapy and to counseling, counseling treatment. So in this way, it means that a person in Palestine or in Iraq or a person who lived there and had their suffering or their trauma happen there, and now they need some counseling or psychotherapy to treat their well-being. It's not necessarily the same experience as a Western person who, as the doctor said, is they lived in a more peaceful, more resourceful place. And therefore, the methodology, the models that are used to treat them, maybe it doesn't work. The other issue is about the language. In this country, the women, again, you know, when you describe your situation, your emotional well-being, traumas that happen to you, or the way you feel about them, your nightmares, it's the last thing you need to think about is to interpret that into a second language in your mind. You need a space where you could talk in the language that you are best at. So you really need counseling or therapy in your own language as well. That's another issue. And as Dr. Al-Fal said earlier, we have a lack of bilingual counselors, psychotherapists in this country, so therefore they are not meeting the demand of the mental health need of people from the other ethnic minorities in the country.
Dr. Jabr, you've spoken about the impact of political prisoners returning to the family after years of imprisonment. In fact, you just mentioned the impact of the father. In what ways can their mental health be affected?
Well, let me first point to the fact that almost 30% of the Palestinian male, 30 to 40% of the Palestinian male population has been arrested, and torture and maltreatment is commonplace in Israeli prisons. And torture and maltreatment leave people with severe injuries and scars to their psyche. For a person, for example, these scars and injuries touch the person, and they touch the family, and destructure the family, and consequently they intimidate the whole community. Some people come out of prison as shadows for the persons they were earlier in their lives. They come to the family, they find it extremely difficult to integrate. They come back to the family after 10 or 15 years of imprisonment. They found that the eldest son or the brother, the uncle of the children, took his role, became the father of that family. And it is difficult to change that structure because many years passed by, and because a severe damage has happened to this person who spent many years of life behind bars. This is also true for minors. We see in the experience of adolescents and minors, these children were arrested in extremely difficult conditions from their schools or from their homes, where the parents and the teachers failed to protect them. And they find it difficult once they are freed from prison to go back and be integrated in school or in their home, because the authority figure in home or in school, the teacher or the father, failed to protect them at a certain point, and it is difficult for them to accept the authority of these people again. So it's a big destructuring and disruptive experience for the home and for the community.
Dr. Jabr, we've got to leave it now, but thank you so much for your expertise and your time. Thank you.
Sure.
I want to ask you both finally.